The typical symptoms of a heart attack for women can be similar to that of men: pressure, tightness, heaviness in the chest. Sometimes it radiates to the jaw or to the neck. For women, sometimes it goes to the back. Sometimes it's just shortness of breath without any pressure or tightness. Sometimes it can be nausea, sweatiness. Some of the unusual symptoms of heart attacks for women can be shortness of breath, or sometimes just nausea. Sometimes it can be an unusual sense of fatigue or tiredness that can persist over several days. We know that there's a list of symptoms that could represent heart attacks for women, but women also need to know that they could just have one of these symptoms. They don't need to have all of them. They can just have one of these symptoms and still be having a heart attack. It's important for women to call 911 immediately, otherwise heart muscle is lost and complications can be terrible if women wait. The longer you wait with a heart attack, the less there is to do as far as treatment to open up blood supply and make sure that the heart muscle stays as strong as possible. I think women feel uncomfortable calling 911. Sometimes they don't think that they really have a problem. They think it's indigestion. They'd rather stay at home. They don't want to be embarrassed to go to the emergency room and be told, oh, you're just anxious, go home. They're much more likely to have their husbands get into the emergency room and push them and encourage them than they often are to call themselves. It's helpful for women to know that to increase their survival, they absolutely need to call 911 if they're having heart attack symptoms and get into the emergency room as soon as possible. The Make the Call, Don't Miss a Beat campaign is absolutely essential. We realized that women were not calling 911, that women were not recognizing symptoms. This campaign is going to save women's lives. So the important thing is to make sure that you call 911. Don't be worried that your doctor is going to not be informed. Once you're in the hospital, the hospital can always speak with your doctor and get some important information about your health from them. But don't delay. The time that was spent trying to reach your physician is time that's wasted in getting you the help that you need. We know from surveys that women are not likely to call 911. In fact, only half would call 911 if they thought they were having a heart attack as their first step. So it's very important that we increase that number to 100% as much as possible. So we know that African American women are at higher risk of having heart disease than other groups. So it's very important that they call 911 because their risk is 40% higher than Caucasian women. My personal wish for women is that, knowing that more American women have died of heart disease than American men, and even though the rates are declining, that I don't want any woman to miss an opportunity to get the care they need to prevent a heart attack from causing a devastating event in their life.
Initially, I had this excruciating chest pain. I also was perspiring. I was very nauseous. I was short of breath. I also I vomited, so I just was really sick. When I initially felt the symptoms that I was really sick, I still didn't know what was wrong with me, so I still thought, well, maybe I can continue with my plans. But I still continued to get sick. And so my best friend decided to take me home. And as we were traveling toward my house, I told my friend to call 911. Once I arrived home, my friend dialed 911, and the ambulance shortly arrived. And once the EMT came into my home, he began to ask me a series of questions. He asked me if I was having chest pain, and I told him yes. I learned I had experienced a heart attack after having been transported from my home to the hospital. In the emergency room, I heard a doctor tell my best friend that I had had a heart attack, and they were admitting me to the intensive care cardiac unit. I did not believe I was having a heart attack. I didn't know what was wrong with me. I just knew I was really sick. Something out the ordinary was happening, but I didn't know I was having a heart attack. Heart attack never entered my mind. I didn't imagine I could have a heart attack at 40. I didn't imagine I could have a heart attack at any age. My advice to any woman that may have any kind of symptoms related to a heart attack, they should immediately dial 911. I am personally supporting Make the Call, Don't Miss a Beat campaign because I personally am a heart survivor and also a women heart champion. And I really don't want another woman to experience anything that I experienced. Women Heart is interested in the Make the Call campaign because Women Heart is interested in saving women's lives. They want women to know the symptoms and to call 911. If a woman is having symptoms of a heart attack, I would urge them to call 911 like I did. It saved my life.
It's important for women to call 911 when they experience symptoms because the best possible outcome is when you call 911 early. That way you can receive treatment in what's referred to as the golden hour. Women really need to make health a priority for themselves, and the way to do that is to take their health seriously. And when you experience a sign or a symptom of a heart attack, even if it's only one, make that call. Don't miss a beat. Women are sometimes hesitant to call 911 because they may be afraid they don't want to bother people, they're afraid of the appearance of their house or their personal appearance, but that doesn't matter. 911 is here to help and we want you to call. Well, I support the Make the Call campaign because not only am I a public health professional and a certified EMT, but also as the daughter of a mother who had a heart attack, who was hesitant to call 911, it's very important to recognize those symptoms, and if you've experienced a symptom or even one symptom, make the call. Don't miss a beat.